Hi, this is Dr. Eric Donor, and I'm going to talk to you about Let's Start with Skin, or the No BS Guide to Clear, Smooth, Beautiful Skin. This is for the woman 35 on up who wants to maintain and restore their natural good looks without surgery. What are you going to learn? Why your complexion is so important, what are the enemies of a great complexion, and how to get clear, smooth, peaches and cream skin. So who am I? I've been around for a long time, and I have all the lasers and all the treatments that you can need. I've written 2 books, and I'm working on 3 more right now. Yes, I did meet Joan Rivers, but I'd never treated her. So why am I teaching you this? Well, because it's easy to get caught up in all the hype in the magazines, and taking care of your skin is the easiest thing to do. Of course, it's not a vain thing to take care of your skin, because you brush your teeth and paint your house, don't you? So let me give you examples of beautiful skin. Here's my daughter Hope at her prom, and you can see how glorious, clear, and smooth her skin is. Yes, of course, she has a few zits. And here's my daughter Claire, and yes, that's a birch bark dress she's wearing. And then here's Ilsa on the left and Claire on the right. And yes, they have a few zits, but you can see that they have clear skin. So what are the causes of problems and the signs of aging? So complexion is number 1, wrinkles number 2, and sagging number 3. The problems with complexion are many. And so why is it important to have a clear, smooth complexion? So here's the definition of healthy skin. Smooth, firm, tight, even, hydrated, tolerant. And so you can see why having healthy, clear complexion is important. So what are the enemies of your complexion? Sun, aging, oil, moisturizers, which I'll talk about, and smoking. Here's a problem example with skin. This is melasma. Here are broken capillaries. Here is just an uneven complexion in general with sun damage. You can see that this woman had her lips enhanced and injected, and they look a little bit better, but it's hard to tell because her complexion's so bad. Freckles. Freckles do not make you look young. This is called poikiloderma of Savant. It is not a rash on the neck, but it's due to sun damage. You can see the white area where her chin protected her. These are seborrheic keratoses. Hope you never get them. Another example of a seborrheic keratosis, which is benign and relatively easy to take care of, but you're going to grow more. This is due to plucking and shaving hair on the neck. These are called actinic keratoses, and these are precancerous, and you must take care of them. Of course, there's acne and zits. These are called milia, very hard whiteheads under the skin that have to be removed with a special process. Of course, there's acne scarring. And there's 3 kinds of acne scarring. Don't forget your hands with the brown spots that make you look old. And don't forget your décolleté or chest. So what is the solution? Is it hopeless? Well, you wouldn't be watching this if you thought so. Look at this before and after. Freckles, before and after. Just by taking care of the freckles, how much younger. Here's an extreme example of freckles before and after. Look how much younger she looks. This woman had a laser treatment to her face, neck, and décolleté. Look how much younger and refreshed she looks. This is amazing, isn't it? This is an example of rosacea being taken care of with some laser treatments. And this poor woman had acne fairly severely. But you can see how much better she looks. So let's dispel some misconceptions first, okay? All right, I've got dry skin, need to use moisturizers every day. Well, guess what? Moisturizers cause all kinds of problems, including sensitive skin, dry skin, accelerated skin aging, and fragility. I meet women all the time who are using moisturizers and have whiteheads and blackheads. All right, my freckles are cute, make me look young. No, they don't. Freckles look good on a 12-year-old, maybe. They don't look good on a 40-year-old. You do not need to spend an hour on your skin every day in order to make it look good. Maybe 3 minutes in the morning and 2 minutes at night. Everyone can do that. You don't have to wear sunscreen in the winter, even in upstate New York. Well, here's a truck driver. His skin says otherwise. Look at the sun exposed side. So, sensitive skin, tap water makes me break out. I hear this all the time. So, who gets it? Men and women? Only women do. And so, what do you do with that expensive glop you got at Macy's that isn't working? Well, you can give it to your sister-in-law or use it on your feet. So 80% of the solution for your complexion is just what you use at home. 80%. The other 20% is lasers and peels. And of course, treating the precancerous spots is important. We can remove moles without a scar. Now, working on your skin at home. Most important, get skin ready. Cleanse, scrub, oil control, and then the other steps, which I'll review then. Wash, scrub, or exfoliate, and oil control, if you have oily skin. Did you know that 85% of women have oily skin? You also must use something for DNA repair and vitamin C. Vitamin C helps brighten the skin and stimulate it. And then there's retinols or vitamin A. And there's all different strengths of vitamin A. And then if you do have a problem with uneven skin tones or brown spots, using fading agents. And then other things is needed for acne. And then of course, protect. That's sunscreen. Here's a typical regimen with Zeo Skin Health. I trained with Dr. Obagi several years ago, and it's the only skincare line we now cover. Here's an example of a woman who was 37, and you can see her skin was pretty bad. Lots of sun damage, pore size, etc. And just by what she used at home, in 3 months, she went from the top to the bottom. That's pretty good with just home care. Only a few minutes twice a day. Everybody can do that. Now, if you have really bad skin, it can take 6 to 12 weeks to really start to see repair. And during that time, you are going to be a little bit dry, peely, burny, itchy, but you'll be slightly miserable, but you won't die. And the stronger you get into it, the faster you do it, the faster you'll get over it. There are Zeo Skin Care systems to treat almost every kind of condition. Actinic keratoses, these are the precancerous spots on the skin. For every 10 on the surface, they're going to come out. Here's a before and after of something called photodynamic therapy. Rosacea, chronic lifelong inflammatory skin disorder. Acne, acne cysts, whiteheads, thickening of the skin. And this slide I love. That shows all the different forms of acne, and they can all occur together. Pores, oil glands, pimples and pustules, lots of triggers including alcohol. Dr. Obagi has developed a great product called Rosacea for red sensitized rosacea skin. This doesn't just cover over the redness and the whiteheads and blackheads, it actually helps treat them. Now, laser also helps treat rosacea and facial veins by heating up the blood vessel, sealing it shut, can't carry it. Look at this poor woman. Look how much better she looks. Blood vessels on the cheeks. This is a former secretary who had very severe redness, wore very heavy pancake makeup. Even men get them. Look at that nose, much better, just with a little laser work. On the cheeks. Even works on the décolleté or chest. Here's a combination of brown sun damage and blood vessels. And it can even work on Asian skin or ethnic skin. 3 different ways to do the laser. I call it baby bear, mama bear, papa bear, depending on how fast you want to get to goal and how much downtime you can have. Now, if you have a teenager who has acne and they won't use their topicals at home, we have a great laser just for that they can come into the office. Resurfacing with CO2. What it does is it works on the skin by creating treatment zones. This is the kind of results you can see. Here's a man's forehead. So let's talk about the vacation peel or the Obagi blue peel. This is a great peel, and here's a patient of mine. She went from looking like a 80-year-old grandmother to a hot 50-year-old. Here's someone else that we treated. Here's someone else. Look around her mouth. It also works on that crepey skin. So it went from that crepey skin on the side of her face to very smooth skin. Here's someone else. Look at her mouth. You don't think she was thrilled? Crepey skin, befores and afters. Same woman on the left, 35 years old, on the right, 55 years old, who looked younger. Let's talk about Exfoliate. Exfoliate uses radio frequency to tighten skin. It's colorblind. It can help tuck in that little turkey neck. It can melt a little fat as well if you have it. Same thing here. We like to call it the lunchtime facelift. Hair removal, laser hair removal kills the hair follicle. And look at this. This woman was plucking and waxing, and you can see the improvement in the complexion that she had. Briefly, Thermiva, the new solution to female incontinence, drop bladder dryness, and pelvic looseness. Women love this. Non-invasive, non-hormone, non-drug. So it takes about the same as a cup of coffee at Starbucks per day to get great skin. So call me, Dr. Donor, New York Skin and Vein Center, Binghamton, Oneonta, and Norwich. Hope to see you soon.